Health experts say a new study on obesity sheds more light on the link between weight gain and the risk of serious illness. The massive research project, which involved nearly 3 million sets of data, suggests that even being slightly overweight doubles the chances of developing type 2 diabetes. The results have been presented to a European conference in Glasgow, and our correspondent Alistair Sanford is on set with us to discuss them a little bit more. Hi there, Alistair.
Morning, Belle.
Well, let's start with what's new about this study.
Well, the researchers say that what makes it new is the sheer size of this survey. We're not talking about a sample of 1,000 people or whatever. They analysed data from nearly 3 million adults in the UK, 2.8 million to be precise, and this over a long period between 2000 and 2018, so 18 years. And the results have now been presented to this European conference on obesity in Glasgow, gathering health professionals together. Now, it sheds light on the links between serious health problems and what's known as your body mass index. That's a method to calculate how healthy you are using your height and your weight and other factors as well. And it does, of course, draw this link between the more weight you put on, the more the risk you develop of serious illness later on. Now, perhaps not surprising is that adults who are very obese are many, many more times likely to suffer from serious health problems such as heart failure. But there are warnings here, and this is crucial, for people who are even just slightly overweight. And as you said in the introduction, well, the risk of things like type 2 diabetes more than doubles, as does the risk of sleep apnea. And there's also a risk of heart failure that goes up by some 20%.
All right, so quite shocking statistics. Now that we know this, what can we do? What are the conclusions from this study?
Well, the authors say that there are serious implications for public health here. Just take type 2 diabetes, for instance, which causes high blood sugar levels. Now, 90% of people with diabetes have this particular type, and many people don't realise they do have it. It is manageable, but it can lead to various very serious health problems. In the UK, it's been described as a ticking time bomb for the health service there, and it's likely to be the same for other Western European countries too. Now, the report's main author says that over 30 years, the number of people worldwide living with obesity has almost tripled. In fact, if you look at the stats going back further, it's gone up by something like 6 times since the mid-1970s. Some qualifications about this study: it was funded by a Dutch pharmaceutical multinational, so there are some obvious questions there, but it has been passed through the filter, as it were, so it is being taken seriously. The authors acknowledge that the conclusions don't take into account the causes, it just looks at the link between weight gain and health problems. And also it's dependent on the fact that many people might have had issues at the start of the study, and because the data comes from doctors' office surgeries, then obviously many people would have had complications there. Even so, as I say, it's being taken seriously, it is very informative, and above all, it does have this warning for people who are just moderately overweight.